going to show you how to set up an EKG on a resting patient. This is Lacey. She's our volunteer. So first is finding where the placement of the electrodes is really important, because if you mess up those, then you're not going to get the correct reading. So first is V1. For V1, you're going to find the sternum. We're going to put it to the right side of the patient. And you find the fourth intercostal. So 2, 3, 4. And then you place V1. Before you place it, you have to alcohol and then scrub. And that's just to make sure that the area is clean and that all the dead skin cells have been away. UV1. Sorry. And then your V2 is the same. It's directly across from V1, so it's on the left side of the patient. Next is V4, and that's going to be the next, right here. So that's the fifth intercostal space, V4. And then V3 is between V2 and V4. And V4 is located in the middle of the clavicular line. That's where you line it with. So it should be over. Then you have V5. And that's going to be the anterior auxiliary. It's going to be the same alignment as before, but near the anterior auxiliary, so it's going to be right here. And then your last electrode is V6, and that's going to be your mid-auxiliary. And it's the same alignment as V4 and V5 also. So after you have all those done, then you're going to place the electrodes on the arms. So the first one is on the right arm. We're going to do her wrist, and she's resting. So alcohol. Clean. Right arm. And you go from the right arm to the right leg. And this is going to be near her ankle, right above it. Then left leg, the left ankle. Back up to the left wrist. So this is how we place if it was a resting patient, but since our patient is going to be exercising, it's going to change some things. So the right wrist is going to be moved to the shoulder region. You still have to clean. And then the right leg is going to be moved to the upper leg near the hip. And then the left leg is going to be moved to the same region on the left side. And then left arm, same region as the right side. So once you have all the electrodes placed, you're going to put your leads. You have lead 1, and that is AVR, and that is from your left arm to your left leg. Then you have AVL, and that is from your right arm to your left leg. And then your last lung lead is AVF, and that is from right arm your left arm. And the reason you change from the ankles to the hips or the upper leg area and your wrist to your shoulders is because when exercising, you want to make sure that the patient isn't worried about tripping or having something get in the way, because that could stress them out a little bit or could cause injury and mess up their EKG. So this is an EKG setup.